Today, we're here to raise your awareness about healthcare in the community. We want to open your eyes. Don't be fooled. There's a lot that you need to know. We're here on the Doctorates talk show. I am your host, Jennifer Leslie. Meet my co-host,
Dr. Catherine Taken.
Our first guest on this show is Patricia Beaulieu. Pat is an emergency room RN. She has been a nurse for over 40 years. Pat is going to literally blow your mind with the things that she has to say. We want you to hear it from the horse's mouth. So don't go anywhere. We will be right back. Here with us is Patricia Beaulieu. She's the RN who has over 40 years experience. Oh my goodness, you're an expert. That's a lot of experience you have behind your belt. So Pat, people have been dying once they go to the emergency room and then leave. How comes? How so?
There is overcrowding in the emergency rooms. Patients flood the emergency rooms. The doctors can't timely get to the patients, or the nurses can't timely get to the patients. So they push some of them out quickly without even finishing looking at the patient and prescribing, and sometimes they don't even talk to the patients.
Oh my. So are you saying that the emergency room is dangerous?
It's very dangerous. It's very, very dangerous.
Oh my goodness. Did you hear that, Dr.
That is something to wonder about.
Nobody would have known that. If you would tell the ordinary person that is going into the emergency room that the emergency room is dangerous, they would not believe you. What do you have to tell them so that you're more believable, so that they believe what you have to say? Why should they believe you?
I've worked in over 63 hospitals in my 40-year history, and the healthcare has deteriorated because now they treat emergency rooms as primary care office.
Oh wow.
They don't go to their doctors for a hangnail, they come to the emergency room. It overcrowds the emergency room, and then things are missed and patients are booted out of the hospital before they even had a chance to have all their treatment given.
Wow. That's not good. That doesn't sound like a good thing. If I'm in the emergency room and I don't feel well and I'm in pain and they tell me to get out, I'm not going to go. I'm not going to want to go. I'm going to say I'm in pain. Don't you get that?
I had a patient, and the doctor said the patient was discharged. He told him to leave. He refused. So he had security usher him out the door, and 2 hours later the family called, where is our family member? He has not reached home. And the security guard was finally asked to go and check the grounds, and they found the patient dead in the bushes.
Oh my goodness.
Whoa.
That is not good. That is not good. Is this a regular incident? How can you get sick, go to the emergency room, you get booted out while you're still sick, and then you're found dead in the bushes? That is not making sense. What possibly could have happened to that man? Do you think that he was discharged too early? Why do you think that is happening?
All patients, the majority of patients that don't get admitted are released to go home unsafely. And if the nurse says this patient is unsafe to discharge and refuses to boot the patient out the door, then they have a chance of either getting fired or losing their travel contract or something else.
Okay, So basically, you're saying that the staff that works at the hospital, they're powerless. They can't say anything because they're going to get fired if they do. Is that what you're saying?
Well, that's close, but charge nurses particularly are pushing, like the doctors, to get the patients out.
Is there a reason why there's such a push to boot the patient out, so to speak, from the emergency room?
Yes, it's overcrowding, it's underpaying, a lot of homeless people. I was told once to discharge a patient at 3 in the morning who was a known homeless patient with severe respiratory problems.
Okay, so is that a logical reason to boot a patient out of the emergency room, a patient who is still sick, just because, as you just mentioned, overcrowding and underpaying? Is that a good enough reason to boot a patient out of the emergency room, a patient who is still sick, a patient who is not ready to go?
It's negligent. And I say this with capital letters. One of my patients, I was told, this homeless man, to kick him out at 3 in the morning.
Oh my God.
His respiratory...
No.
His respiratory rate was in the 50s. He was struggling to breathe, and I refused to push him out.
Oh my God. 50s. Respiratory rate is in the 50s. That means that you're basically gasping for air. You're in distress. And you're saying that he has to leave because of overcrowding or whatever reason? That doesn't even sound or make sense. So, Pat, what do you think the answer is? What do you have to tell the public? We do not want to give you, the audience, the impression that the emergency room is so bad that you should not go to the emergency room. That is not what we're trying to say. But I want Pat, being that she is the expert, being that she is an RN with over 40 years of experience, she's telling you like it is. She's going to tell you the raw truth, and that is what she's been telling you. So in your opinion, what should resolve this problem? What is the resolution? How can we, as a community, rectify this problem? Because it doesn't sound good what we're hearing.
Absolutely, it doesn't sound good.
The nurses have to stop believing everything the doctor says and wants to do, and the medications and all that. They have to stand up for the patient, because the patient is our responsibility, and our responsibility to save their lives.
All right. So basically you're saying that they need to stand up to whoever it is that's ordering these patients out. But you also said that they could lose their job. Their job is at risk, okay? So then that's the dilemma right there.
That is. I've lost, I would say, about 12 contracts in the 40 years as a travel nurse, because I dig my heels in and I refuse to discharge patients who are unsafe.
So the reason you're here is because you want to do something about it, okay? Why would you want to come and say something like this to the public today? Why? What do you want the public to know?
I want the public to know that they take their life in their hands when they go to the hospitals and are treated without anyone laying their hand on them. The doctor doesn't examine them, the nurse doesn't examine them. They just get on the computer and ask questions and fill in the answers.
And what is your motive for being here today? Are you gaining anything from being here today?
No, I am not. And some of the things that I have to say may cause me to lose contracts, but I don't care. I want the patients to be safe, number one. And that's my ultimate goal.
Okay, we have come to a close. We are on the Doctorates Talk Show. We hope that today we have increased your awareness about healthcare in your community. Welcome back to the Doctorates Talk Show. Our next guest is here with us. Meet Yinka Obalaran. Yinka is a professor, and she's also a nurse practitioner. And she has been teaching for many years. Yinka, welcome to the show.
Thank you, Dr. Leslie.
We're glad you're with us. Our first guest, Pat, just told us that it is dangerous in the emergency room. Now, you may not be an expert in the emergency room, but I know for a fact that you have been a professor and you've taught many students. You've had many students throughout different hospitals doing their practicum, doing their internships. And so I want to find out from you, are you experiencing the same problem in the different areas? Is it, should I just say it's the emergency room? Or do you want to let our audience know that this is something that is standard throughout the whole hospital and not just the emergency room? What is your take on that?
Thank you, Dr. Leslie. Emergency room have been crowded, and the patient from emergency room transfers to the floor. So this is not only problem with the emergency room only, it's the entire unit and the hospitals.
That is appalling, because from what Pat just told us, it could not get any more dangerous than the way she expressed it to us. So if you're telling us that it is as dangerous throughout the hospital system or the hospital floors, then that is very concerning. Is it not, Dr. Tikam?
Absolutely.
So why do you think it's dangerous on the floors? Now, when we talk about the floors, explain to the audience, what do you mean when you say it's dangerous on the floors? What floor are you talking about?
Okay. The major concerns I really have with the patient is related to the patient quality care, in which you probably discussed. On the floor, patients don't get the quality care they deserve in the hospitals.
What?
And due to the staff ratios, the patient to staff ratios is very, very high.
Okay, so basically what you're telling us is that the quality of care in the hospital in general is very low because of the patient staff ratio. What is a patient staff ratio?
Okay, thank you. With my experience of years, over almost 20 years being a nurse, before I even became an educator, and even now as I teach and go to different floors, staffing ratio is very, very dangerous. What I mean by dangerous, example, I'll use med-surg example for you.
What was that? Med-surg?
We have med-surg. We have critical care unit, we have step-down unit, in which they call it progressive unit.
Okay.
That means when a patient comes down from the ICU, they step them down to progressive unit. From there, they might send them to med-surg floor before they go home.
Okay.
It's like a progress of the treatment.
Oh, I see.
However, my concerns is that the staffing ratio is so high that the nurses are unable to provide the quality of care that the patient deserves.
So let's make sense of this. The ratio is too high. So when you say the ratio is too high, there are too many patients to one nurse?
Yes.
So when there are too many patients to one nurse, does that mean that the standard is a certain amount of patients to one nurse? And when that is the case, then the patient gets better care or a higher quality of care because the ratio is good?
If the staff have low ratio, the quality of care, I'll use an example. There was a time a patient was assigned to me. I'll use my example one day. And this was an ICU critical care. In critical care, this is a patient that are in critical conditions. So when you're supposed to have a 2-to-1, according to the ratio.
A 2-to-1 meaning two patients to one nurse.
However, this particular day, I was assigned to 3 patients. Wow.
Okay, so basically, to take care of a patient using good care or given a high quality of care, if you're in the critical care unit, you can't have more than 2 patients because otherwise you won't be able to provide the quality care that you're supposed to be giving those 2 patients.
That's exactly that's exactly what I'm talking about. Because
so does that mean that if you have, let's say you have 3 patients, you're a nurse in ICU, you're supposed to have 2 patients, now you have 3 patients, what happens?
Now I have 3 patients. Also, we have to take into consideration what are the acuities of that patient.
Acuity.
Acuity means the level of the stage of the high acuity of the how serious.
So that means that there are so many things to do for this patient, a lot of things to do for this patient, a lot of things to do for this patient, right. And you being one person, you can only take care of so many things for this patient and that patient, but not that patient. Does that mean that one patient gets left out? The care that other patient needs, that patient does not get. Is that what you're trying to say?
Exactly what I'm trying to say. Because when you have a patient in critical condition, you have 3 patients that are in critical conditions. How can you, one person, manage 3 patients in critical conditions? They are on the mark.
Let me ask you something. Does administration know this? Who should know this in the hospital? Who should be fixing this problem? Why would a nurse end up with 3 patients and they can't possibly take care of 3 patients in ICU? Doesn't the administrator know this? Doesn't the CEO know this? Doesn't the hospital system know this? Who is supposed to make sure, who is supposed to ensure that patients who enter the hospital get the care that they need? Who is responsible?
Thank you very much, Dr. Leslie. The administrators are aware of these issues. However, because of for example, if the census go high, there are some seasoning that the census increase. The census go high, we need more staff to work.
Census?
Yes.
Oh,
census means when we have more
when it's busy.
Busy.
Really busy.
So the administrative know that the managers, they're supposed to rent to hire new staff. However, they don't have a new staff. So they have to, the staff that are available have to manage all the patients. However, some patients get left out.
So basically, there could be a reason why they choose not to hire more staff. But the patients are the ones that is suffering.
Exactly.
How do you feel as somebody with a conscience, knowing there's a problem, knowing that you go to work on a day-to-day basis? Yes, you're not practicing as a nurse, you're a professor, but you are taking students, and the students are seeing these problems. How do you feel? You have a conscience, don't you?
Thank you, Dr. Leslie, because this is a big dilemma. We are training students how to take care of patients, how to give quality care. If we are teaching students
Okay.
how to give quality care, and they are seeing different things.
Okay.
In the hospital setting, so it's
That's not a good thing.
No,
That's not,
it's
a, good thing. Why are you here today? Why are you choosing to come on this show and tell this to the public?
I am here today because I'm really concerned about the effect of this on the patient, how some patients have been dying for not...
Dying?
Yes.
I thought that only happens with the emergency room. Patients are dying on the floor also because there's not enough staff? No, that could not be. Dr. Tikem, are you hearing this?
I am hearing this, absolutely.
What's going on? You're a part of the healthcare system.
You know, this has something to do with money. Maybe you can elaborate on how money affects the care.
Well, I do not want to get my guest into this. This is just a topic that we're going to have to continue. And we've come to the end of our show. Thank you very much for listening. We will be right back. And we are back. I am your host, Jennifer Leslie, and I'm back with my co-host, Dr. Catherine Tikem. We hope that you have learned some interesting things today on this show. We also hope that we have raised your awareness about healthcare in the community. After all, that is what we do. And we are on the Doctorates Talk Show. We hope that you will tune in and watch us at hbctv.org, and feel free to contact us at office@hbctv.org. Until next time.